Hi, I'm Dr. John Martin with Ivy Family Health Updates, and I'm here with my sister, Dr. Catherine Martin, my brother, Dr. Edward Martin, and our special guest today is Dr. Jeffrey Epstein. Jeff is a board-certified facial and plastic reconstructive surgeon who now is a world-famous specialist in hair restoration, and he's here today to tell us what's new in hair restoration. Jeff, thank you for being here.
It's a pleasure.
So let us know, I know, we used to see people with these cornrows of hair transplants, and it was very obvious looking and not very cosmetically appealing. Tell us a little bit about this.
Sure. The days of the plug or the doll's hair transplants is really ancient history. We still see those patients, and those are patients that I do reparative procedures on. But the reality is, with today's techniques, which have been developed over the last 15 years, the time I've been in the field, the evolution has led to the point where we now do what's called follicular unit grafting, which is all microscopic grafts, and it's capable in a single procedure of placing as many as 3,000 or more individual grafts that can provide not only a full look, but most importantly, a natural appearance.
So before you had what, 15 or 20 hairs in each little
Yes, that was the plug, and you can still see those on Barbie dolls.
Okay.
But we don't want to see them walking out of a doctor's office. The surgeon or the dermatologist would take a punch and punch out these 4mm plugs, and then he would take that same punch, or maybe he would go a little small and stick them in. And of course, you do that, they're going to look like plugs. And the concept back then was, well, let's pack it in, so over 3 procedures over a year or 2, they would fill in all the existing holes, so then you'd have a wall of hair, sort of that vice president look, which fortunately for him, he's gone salt and pepper like some of us,
the rest of us.
And it's made his hair transplant look a lot more natural. So with today, we're able to cut these tiny grafts, and it really looks natural.
So they're really sort of one or two, just lots of 1 or 2 hair grafts that will just comb easily and nicely.
That's
okay.
right.
Great.
So is this a procedure for men or men and women? I mean, I have a lot of women that I see in my practice with excess testosterone. They get excess hair in their face, but they lose hair in their scalp.
Mm-hmm. Well, that's when you mention that testosterone, nothing makes a guy happier when he comes in. He says, well, I have all this hair on my chest and my back. I don't have any hair on my scalp. I say, well, it's because you have high testosterone. Right. And if he's with his girlfriend or his wife, he just becomes even prouder. But yes, it is ironic that testosterone, which is a male hormone, in both, certainly in women, can be associated when it's, for example, I think you're talking about PCOS, right. Which I've learned a lot about, not, or coming at it from the hair perspective. There is a high incidence of hair loss in these women, and for many of these women, the loss of hair is one of the most devastating attributes of or components of the pathology. And first of all, around 30% of my patients, to answer your question, is this a procedure for women? Around 30% of my patients are women, which is clearly the fastest growing component of my entire practice. Of those, the women I treat, I would say probably 15 to as many as 20% have some form of PCOS. And in those women, similar that we see with many other women that we treat, the donor hair is not as good as we would like it to be. For men, it tends to be more patterned. With women, it tends to be more diffuse. But even in those women, when we manage their expectations, we're able to create an improvement so they can wake up in the morning and not have to run and put on their hairpiece. They can look at themselves, come out of the shower, and not look like a bald woman. They can look like they have thinning hair, which is a big advantage.
And what's the age range that you see of patients coming in for hair transplants?
Most commonly for male pattern hair loss, I tend to like to wait to a teenager or a young man gets to be at least into his mid-early 20s, so 23, 24. In terms of the upper age limit, I've done both women and men in their late 70s, early 80s. So there's not really any one age group that's not appropriate, as long as it's within there. And then also I'll do some reconstructive procedures on children, such as reconstruction of eyebrows after bites, dog bites and things like that. And those I'll do them on younger patients when they express a desire to have it done.
So you can do an eyebrow transplantation now?
Yeah, it's one of my favorite procedures to perform. Most commonly due to overplucking. But the loss of eyebrow hairs can be due to a past history of low thyroid levels, nutritional issues, and genetics. And these patients want full eyebrows. The only thing is, the eyebrows need to be trimmed, because typically the donor hair, unless I take it from the leg or something like that, which I do sometimes, most commonly it comes from the scalp, so they need to trim the hairs on a like every other week basis.
And one last question would be just a ballpark range for a price for, let's say, a guy coming in with thinning hair.
The average male will need a procedure anywhere from 22 to as much as 3,200 grafts. Fees for that, for like a 2,500 graft procedure, typically run around $10,000. So you're looking at procedures for men that run anywhere from around 6 to 7 to as much as 14,000. For women, it tends to be a little less, unless I'm doing a procedure called hairline advancement, where I'm bringing receded hairlines, whether due to prior brow lifting or just due to genetics, forward. But typically for women, it's more like around 4,000 to 8,000. And then for eyebrows, it's usually around 5. What I remind patients is that these, the procedures, the results are permanent. They may need more work in the future or may want more work in the future, but the results are permanent.
Well, great. Jeff, thank you very much. Very informative.
Pleasure.
Thank you.